So this is an area I find that oftentimes we hear so many, oh, you should follow a ketogenic diet. No, you should follow the vegan diet. No, you should follow this diet. Should you have Kangen water or alkaline water or this kind of water? And that's where it just is very, very confusing sitting in your shoes. And so even as a practitioner, and I've worked with oncology for over 20 years, it's a challenging domain to really be following. And so kudos to all of you for being passionate and committed to your health and doing what you can. I find that the area of nutrition and lifestyle is very empowering.
Natalie, I just muted you by accident. Can you unmute yourself?
Yep, I just unmuted myself. I was like, wait, I think I just now muted.
Thank you.
So I do find that, in an area where we don't have control over everything, that you can really empower yourself by fueling yourself with nourishing foods. We do have control over what we choose to eat, what we choose not to eat, how we live our lifestyle. So I find that that can be a very empowering tool to utilize when you may feel that a lot of other factors in your health could be somewhat out of your personal control. So this presentation, I've kind of highlighted some common, truths and myths that we'll go through, and then obviously want to allow some time for Q&A as well. And just to give you a little bit a background about myself, as I mentioned, I'm worked with oncology for 20, I think now we're at 22 years. It's a passion of mine. I really found that it just helps it felt like it was giving more to society by really helping those, with oncology. My initial focus was sports nutrition. I love sports, but it just didn't seem like it was quite as much of a gift to others. So I'm very passionate about this connection. I really work to personalize nutrition for each and every, each individual to determine what would be the best recommendations, whether that be diet, whether that be testing, whether that be foods and or supplements. How do we help to best personalize that? And that will come a little bit more to life as we go through our discussion today. So I will dive in. Some of you may have seen this before, but this is the short history of medicine, where in 2000 BC for earache, we said, here, eat this root. That transitioned in 1000 AD to no, that root is heathen, and instead you must say a prayer. 1850, the prayer was superstition, so instead we were told to drink a potion. 1920, the potion snake oil, instead we need to swallow a pill. 1965, the pill's ineffective, take this antibiotic. 2000, that antibiotic is artificial, here, eat this root. So we definitely have seen kind of this cycle, and you could take it even now being 20 years later, and I think the question is, well, should it be the real root? Should it be a low carb root? Should it be a high fat root? What are we really trying to get at within this root? But I do think that you oftentimes will see these cycles with nutrition and with dietary advice as well. And so it's good to kind of look at history to have a sense of, wait, is this just going to be a trend to kind of move through, and really, where are we? So I can't go through a presentation on nutrition and not at least mention and focus on what about vegetables. So of course, truth there, yes, veggies are indeed, beyond good for you, but we want vegetables, in our diet, fruits too, but particularly vegetables, so that they are going to, help us to achieve a greater vitamin, content, mineral, dietary fiber, and they're a host of a variety of different protective cancer-fighting phytochemicals. And then naturally, if we fill up our plates with lots of vegetables and fruits, well, then we're going to naturally have a lesser consumption of animal fats, animal proteins, processed foods, things that we're trying to likely limit in our diet, to some extent. So generally, I like the idea of following a plant-based diet that is rich in vegetables and fruits, possibly beans or legumes, nuts and seeds, and so forth. And plant-based, from my perspective, I'm not meaning that it has to be exclusively plant-based and vegan, but that we are getting the majority of our nutrients from plant foods, and then we may use those animal foods to help make up, that 20% difference or so. So filling that plate, I think, is definitely an important piece. This study here on the bottom bullet point here, this is from the Women's Healthy Eating and Living study. This was a study that was looking at the risk of diet and recurrence of breast cancer. And this is a multi-site controlled clinical trial conducted many years back. And essentially what we got from that was if one had 5 servings of vegetables and fruits a day, and that was even in combination, it wasn't even 5 vegetables plus more, but 5 vegetables and fruits a day, and we're basically walking 6 days a week, 30 minutes a day, that it significantly reduced the risk of death after early stage breast cancer by about 50%. Now, of course, I would love to put in a study here on sarcoma, but as you've probably found, there is not a plethora of research out there on sarcomas and diet. So we hope to be building that beyond, further and further. But in this presentation, I'll try to mention different types of tumors just because sometimes I don't have data specifically on sarcoma. And so we're going to kind of look at a variety of different types of cancers. So here, if we're thinking of your plate, and while I do definitely emphasize, live foods with the vegetables and fruits, I didn't actually mean for these carrots to be truly live and moving. But essentially what I'd like to see is that half of your plate be filled with vegetables and or fruits, and then likely 25% of your plate, possibly a little bit more depending on the situation, of some sort of lean animal or plant protein source. And then if allowing that, up to 25% of your plate with some sort of starchy vegetables like sweet potatoes or butternut squash, and or a whole grain. And then we sprinkle the healthy fats throughout in terms of condiments, and that could be the avocado, olive oil, nuts and seeds, and so forth. And I don't expect your plate to look like a little bento box, but the idea just when you're looking at your plate, particularly for lunches and dinners, do I have vegetables, number one? Do I have protein, number two? And does it seem like it's in an appropriate balance? If it's 4 cups of pasta and 1 sprig of broccoli, I'd say, no, we don't have the right balance. We want to have lots of those vegetables, have that protein in there. And then if we are like, some going to allow something like, pasta, could we then have maybe up to 25% of that? So we'll talk about more specifics, as well. So in terms of those plant foods, as I mentioned, the protective cancer-fighting phytochemicals, these are going to basically become in all different colors. And so that's one of the reasons why you oftentimes read, oh, I should be eating a rainbow assortment of different types of vegetables and fruits. And that's true. We want to get all different colors in our diet. Each color is going to offer us different types of phytochemicals. And white could be okay. Like in the picture here, you're seeing cauliflower. Garlic would be another one that I'd put in that category. But when I'm thinking white here, we're not meaning white rice, white pasta, white bread, white refined, flours and sugar. So. And I am noticing I'm a little bit dark. I'm sorry. I ran to my neighbor's house because my house, their kids running back and forth. And so I thought it may be a little bit more quiet and conducive to be over here. But I do see it's a little bit dark. So hopefully it doesn't put you to sleep if the slides are bright enough. So this slide helps to show the different colors and what they offer you. So you can see that every color has different types of phytochemicals. For example, lycopene is oftentimes found in brightly colored red vegetables and fruits. Anthocyanins oftentimes will be found in berries, that kind of purpley, red bluish, color. You can see the carotenes, and you're familiar likely with beta carotene being found in the orange foods. It can also be in the dark green foods, but each color providing you different types of phytochemicals, and those phytochemicals function in different ways. So they may function to inactivate a cancer cell. They may function to strengthen your immune system. They may function to detoxify the system, different ways that they are working. And so that's why we want to make sure we have a good amount of colors within the diet. This slide's taken from Dr. David Heber, physician down at UCLA. He wrote the book, What Color is Your Diet? There's also a book, these are both a little on the older side, called Color Code. And if you are interested in that area and you just want to have something that's pretty easy to read, that doesn't overwhelm you, but still gives you enough little science to motivate you and incite you, I think the Color Code is a nice, easy read. The chapters are red, orange, green, so it's definitely one that I think can be followed well and still be inspiring and help to encourage you to eat the colorful plant-based foods. So another common discussion that we always hear is, what about sugar, right? Does sugar indeed cause cancer? Does it feed cancer? And I think essentially what we have at this point is that I would say, well, we certainly know that sugar and added sugars are not going to be providing you nutritive content. They're not going to really be providing you, and I should say nutritive in the sense of a protective, healthful component. Yet we don't have evidence that says that sugar is indeed going to cause cancer and or necessarily feed cancer. Now, there are some caveats to that. And I would say that in general, we do see that those who have diets that are richer in dietary sugar and or if our blood sugar is higher, or A1C values or other markers in our blood that are suggesting higher sugar, that is not favorable for a cancer perspective. And oftentimes you see poorer survivorship along that line. So it doesn't look to be, it doesn't necessarily mean that, oh, it doesn't cause cancer, then I should go and eat all of that. No, I'm still not going to be encouraging you eat, ice cream and bonbons, but we want to make sure that we're presenting it from an evidence-based approach. So from our nutritive perspective, generally foods that are going to be high in added sugars are generally not going to have much of true nutrient value. They're not going to have a lot of fiber. They're not going to have a lot of, vitamins and minerals and phytochemicals. So from a nutrient perspective, they're not really providing us much benefit there. What about from a metabolic perspective? This is an area that I think is interesting, is there's research to now suggest that the way that sugar, and this is particularly high fructose corn syrup, is processed, it does appear to possibly even lead to an increased fat mass, as well as more metabolic disease. And this can sometimes be in terms of liver, because we know that fructose in particular gets metabolized by our liver, which then turns our fat and secreted in the blood with the very low density lipoprotein particles. And oftentimes we see that sugar is one of the most significant ways that we increase serum triglycerides. Triglycerides are oftentimes assessed, or always assessed, when you're looking at a lipid panel. So whenever I see elevated triglycerides, and I would say elevated, it would be above 100, even if the marker is saying it's above 150. I really don't like to see triglycerides above 100. Then my first thought would be, what about sugar and what about alcohol? Those are two significant factors that could really influence that triglyceride marker, and also total cholesterol, but I'm really particularly thinking here of that triglyceride piece. And then also from a hormonal perspective, too many buttons on my computer to be able to see. And I'm trying to see if there's a way I can see the chat simultaneously without, I think the way I'm presenting it, I can only see these slides. So I'm going to try to open the chat just in case I see questions that are relevant as we're going along, too. So, okay. So from a hormonal perspective, one of the other questions is, does sugar and the intake of dietary and added sugars, does that lead to the challenge of insulin resistance? Talk a little about insulin resistance. Insulin resistance is linked to diabetes, but again, greater insulin resistance likely going to increase the risk of cancers and likely be able to possibly be more inclined to fuel and promote but not only encourage the development, but also the promotion and possible metastasis of different types of cancers. And so I do think of sugar being along in that, realm we want to be very cautious with. Additionally, I think we probably all have experienced this at some point in our lives. The reality is sugar leads to a relentless biochemical drive that we want more. and we want more and more. The more we have sugar, the more we want it, right? If you have sugar or some sort of sweet treat every night after dinner, guaranteed you're going to want to have a sweet treat every night after dinner. So that oftentimes can also be a challenge. Now, there could be times where maybe you're craving chocolate because you're magnesium deficient. Maybe we're craving sugar because thyroid is too low. Maybe we're craving sugar because you don't have enough protein. Maybe you're craving sugar because you don't have any carbohydrates. There are other factors that can, of course, lead to that. But I do think that we know that sugar can be more of an addictive component. And we want, once we have it, we do typically want it. And we want it again. And we want more and more. With mortality, we do see that a greater sugar intake is associated with a higher mortality risk. And if we look at the overall Western lifestyle, and that's not necessarily meaning just sugar, but if I think of a Western lifestyle characterized by typically, unfortunately, lower physical activity, a higher amount of overall caloric intake, a higher amount of animal protein, of saturated fats, of trans fats, meaning hydrogenated oils, and also of rapidly digestible carbohydrates. What are rapidly digestible carbohydrates? Those are your sweets. That's the white bread, the white rice, the pasta, the cookies, the cakes, the scones, and so forth. We know that that lifestyle is inevitably associated with a greater risk of a variety of different types of cancers. Again, sarcoma research, unfortunately, is more minimal, so it's hard to be able to see that, but you can see this with so many different types of cancers that I would be thinking along the lines that sarcoma is going to fall in a similar boat. Why would this be the case? One of the components is that likely this is mediated by alterations in what we call the metabolism of insulin and factors called insulin-like growth factors, or IGF. And we know that having higher insulin, higher IGF levels generally can really drive the development, the promotion, and the metastasis of many different types of cancers. So that's one of the areas that we oftentimes look. And I do like to see, well, how is somebody's insulin level? How is somebody's glucose value? Where are their A1C values? So we know, is this an area that's of concern, or is it a little bit of a lower priority? So additionally, we know that insulin-like growth factor could also promote tumor development by inhibiting the protective process called apoptosis, which is kind of a programmed cell death. So we want to have cancer cells dying, of course. Additionally, in terms of the proliferation, stimulating the synthesis of sex steroids, modulating the way our genes are expressed, and also inhibiting the synthesis of sex hormone binding globulin. So this slide here, you can see with the normal cell at the top, and then we have an insulin resistant cell at the bottom. And the glucose is noted with the little red circles, and you have insulin there noted by the blue 1, 2, 3, 4, 6 hexagons, right? So what you see there is typically, we eat, and in our blood we have glucose, we have a little bit of insulin, and if we really want to pull that glucose and insulin, or the glucose into the cell to say, okay, I'm nourished, I'm satiated, I don't need to have any more food, I don't need to have more, I don't want to have my blood sugar go too high. Then what happens is the insulin then attaches to that receptor site, allows that channel to open, and then the glucose, the little red circle, is able to pop right through these channels and get inside the cell, okay? This is how it would work in a healthy, normal scenario. If we are in an insulin-resistant scenario, what happens is we have glucose in the blood, yet it's not getting inside the cell. And so the body thinks, well, I'm still hungry, I haven't eaten any food because it's not in my cell, or I'm not getting the message. So instead, the body puts out extra glucose and more glucose. Look at how many little red circles are in this area. And the higher amount of glucose, then you look at the insulin, and the problem here is that the insulin is resistant to sitting in that little channel. So we have a couple of them sitting in the channel to allow a little bit of glucose to get inside the cell, but you can see highlighted by these kind of rust-colored channels that the insulin just isn't sitting properly, and so it's not allowing that channel to open to get the glucose inside the cell. And this oftentimes, when this occurs, we tend to see, of course, higher diabetes. We tend to see weight gain. We tend to see higher triglycerides. I think we definitely are likely going to increase the potential for cancer and also the cancer cells to further proliferate. So we want to make sure that we don't have an insulin resistance scenario. Additionally, as I mentioned, higher insulin levels, higher IGF levels are associated with increasing risk of different types of cancers. Here, I just noted the first trial looking at those higher in IGF, really increasing the risk of all-cause mortality. I think that was a breast cancer trial. Then we see IGF again positively associated with the ER-positive breast cancers, and I wanted to note that just because I know sometimes we're also going to be talking about estrogen receptor and how that may play a role in with sarcomas as well. And then, like I mentioned, it also could lead to a poor prognosis. And again, heart disease, type 2 diabetes, weight gain, obesity, and also having a more of a deficit or detrimental effect on our immune system. So one of our challenges is that when you walk up and down different grocery aisles, and now we're doing that generally masked, and some, only going one direction these days, sometimes depending on where we're located. But 80% of our food items are spiked with some sort of added sugar. Now, we would expect to see added sugar if you're looking at a, pint of ice cream, or if you're looking at a bag of cookies. But you'd be surprised to see that we see sugar even if you're looking at marinara sauce, if you're looking at salad dressing. A lot of these savory foods are also spiked with added sugar unnecessarily. The challenge there, and this is estimated by UCSF, University of California, San Francisco, 1/3 of Americans are likely going to have diabetes by 2050. And again, higher blood sugar, higher diabetes likely also is going to be and has been associated with greater cancer scenarios, both prevalence and likely also advancing disease. So as I mentioned, we don't have evidence to say, oh, definitely sugar is going to indeed cause cancer, but we do see data suggesting that higher consumption of sugar via sugar sweetened beverages, that's just going to be to kind of help make things not be too full on the slide. So Coca-Cola, Arizona iced teas, other kinds of sweetened beverages, definitely have been associated with the increased risk of disease. And this top one, you can see that was a prostate trial. This second bullet point here, this was a breast cancer trial looking at a, double risk of breast cancer with those who are consuming more sugar in their diet. We see sugar, we see dessert intake also associated with the increased risk of breast cancer and also liver cancer, hepatocellular carcinoma. So ultimately, bottom line with sugar is, number one, if I say don't do something, the only thing that sticks in your head is what we can't do. That's not generally a very effective approach. So instead, I'd say be really, focusing on the positive. Focus on, did I get in enough vegetables today? Did I eat a few fruits? Did I have protein with my different meals? Do I have enough fluids in my system? Am I adequately hydrated? Have I moved? Focus on all of those healthful things, and then oftentimes you'll find, oh, now I'm satisfied. I don't necessarily need to have that, and you don't feel like it's something that you're restricting and not allowing yourself to have, but instead you're focusing on, did I, get these other things? At the same time, you decide, yes, I do want to have a piece of chocolate today. Then I would say, okay, I don't feel like there's anything that you can never, ever eat. I'm not going to encourage you to eat some of these different foods, but I don't think there's anything that you should say, I can never, ever eat this again. Because again, as soon as you put it on the forbidden, prohibited list, you're going to dream about it, you think about it, it's hard to get out of your head. So instead, I would say, focus on the things we're trying to really get in. And if you decided, okay, I'm going to have chocolate, I'm going to make it be dark chocolate, so it's more than 70%, that cuts the sugar down. There are some antioxidants in that. And then I would say, okay, have some dark chocolate. Don't eat 5 pounds, but you can have, depending on the size, a square, 2, or whatever, reasonable portion. And you can't just wake up and have that dark chocolate. Instead, think to yourself, okay, Did I eat vegetables? Nope. All right, no chocolate till you go and eat some vegetables. Did you have protein with your meal? Nope. Okay, go back and eat protein. But if you did have vegetables and you did have protein, you are adequately hydrated, and you've kind of hit these different criteria that you're really trying to nourish your system, and you then say, okay, yeah, now I can do that. Then at least I know you're getting in the good stuff, right? So that's definitely, I think, an important line. Now, one thing that you can kind of keep in mind, and this is, in terms of nutrition facts labels, yes, the healthiest types of foods probably don't even come with the nutrition facts label because they're just whole foods themselves, produce, and so forth. But oftentimes, a lot of the foods we do have labels. So one thing you can keep in mind is the 10-to-1 rule. And the 10-to-1 rule is basically for every 10 grams of carbohydrates that are listed on the label, you want to make sure that there is at least 1 or more grams of dietary fiber. So in the example here, we can see that for this serving size, if you were to eat 5 crackers, it would provide you 9 grams of carbohydrate, and there's less than 1 gram of fiber. So you'd be like, well, is it 9 to 0? And it's kind of right on that edge. But essentially, you're like, oh, if you saw something that had 30 grams of carbohydrate, then you'd want it to have at least 3 grams of fiber. If it had 10 grams of fiber, you'd be like, okay, this looks like it's a high fiber food. For those carbohydrates, I'm getting in a lot of fiber. If it had 1 gram of fiber for 30 carbs, then you put it back on the shelf. But the 10-to-1 rule, kind of keep it in your mind. You can always take it with you when you're shopping at the stores or if you're shopping online, something to kind of just tangible to keep in mind. If you're looking at breads and or a cereal, well, we can talk about those individually too, because pros and cons there, but typically look for about 3 grams of fiber or more per serving. And that will kind of give you a sense of, is this really going to provide you enough dietary fiber? And or if it doesn't have the fiber, it probably is going to have more in the way of sugar, okay? We want that fiber to satiate you. We want that fiber to bind to different toxins and help to get toxins out of your system. We want that fiber to help keep you regular. So I want that fiber to help keep your cholesterol in check. A lot of different therapeutic properties that we have from dietary fiber. Microbiome, that's a whole other avenue in itself, but definitely helps to have our microbiome be more diverse and hence be able to fight off infections and have a variety of other health components to that. I do see a couple questions coming in terms of other alternatives to sugar. I'm going to jump to those in just a second. But before I do that, I just wanted to show you a few different labs. This is something that in terms of helping to best personalize one's care, if I'm looking at, where somebody glucose is, what about their hemoglobin A1C values, what about their insulin levels, in some scenarios, even looking at C-peptide, but definitely bottom line, I know you're already getting glucose, request an A1C level. And if your A1C level is 6.0, we know that there's some challenge. If it's 5.7, it's higher than we wanted. If it's 5.0, kudos to you, fantastic. You're in a good position. We want to keep it there. But that helps to give you a sense of if you were to be able to, how well your system regulates those carbohydrates somewhat dictates how many carbohydrates would it be better for you as an individual to possibly consume. And so these values help us to personalize where those, what kind of carbohydrate suggestion should one have as an individual. So A1C values, those are mainstream. They should be able to be tested through your insurance. Work with your medical team. They should be able to add that at a future screening. If possible, you could even do a fasting insulin. Insulin is definitely better to be done fasting. A1C can be done fasting or non-fasting. Insulin probably would really be better to be done in a fasting condition to have a sense of, are you insulin resistant or are you not? These are some values I think that can be very useful biomarkers. Now, what about sugar and how our systems regulate sugar? I show this slide. This is from SpectraCell Laboratories. I use their micronutrient test panel frequently, and I find it's, gives us a lot of information. But one of the pieces here is that we can see that sugar and blood sugar regulation and carbohydrate metabolism is manyfold. It can't just be, oh, I have a little high sugar, I better take vitamin D, or I have to take magnesium, or I need to take zinc. And I would not expect you to take all of these different things listed on this slide, but instead, well, are you deficient in any of these values? Well, those are the areas that I would focus on. If you have replete levels of a lot of these different nutrients, there's be no reason to focus and supplement those, further. But I just bring this as it is a complicated piece, as there are so many different factors that affect our blood sugar and affect how our system is metabolizing sugars and carbohydrates in general. So general dietary strategies to improve glycemic control. We want to avoid white, refined flours, grains, sugars, and added, things like that. We want to make sure you're getting in a good amount of dietary fiber. Typically, if you're getting in vegetables, love it if you get vegetables at all of your meals, but definitely vegetables with at least lunch and dinner. That will help to get in, some fiber. We add in some chia seeds, you add in a little bit of this seed, you add a little bit of black beans, you're there. We want to make sure we're having healthy fats, particularly protective omega-3 fatty acids like flax seeds, chia seeds, cold water fish, walnuts, things like that. Be careful of eating carbohydrates on their alone. So if you're going to have an apple, you may find that an apple with a few almonds or apple with some other protein could be helpful so that your blood sugar doesn't go up and then crash down. Instead, it makes more rolling hills. So that can be something just general to think about. Limit the real starchy carbohydrates just up to 1 to 3 servings on a daily basis so that we're not getting loads and loads of those starchy carbs if we need to improve glycemic control. Limit beverages that are adding sugar, particularly high fructose corn syrup. Be cautious in terms of evening snacking and also kind of looking at the size of your evening meal. We'll talk a little bit about intermittent fasting in a moment. Cautious in terms of caffeine intake, and then also keep in mind to limit or avoid alcohol in terms of managing good glycemic regulation. So what about other options for sugar? What about artificial, sweeteners? Would they be a good substitute? And my answer would be no. I would rather you eat sugar than a lot of those little colored packets, okay? And there are, is there research to say that artificial sweeteners like Splenda are going to definitely cause cancer or increase your risk of cancer? No, we don't have that kind of data, at least yet. But you can see here, Splenda increasing the risk and having associated, components. This is, of some cancers. The top one, there's another study said that no, there wasn't really any relationship of the artificial sweeteners and cancer. And then one study actually even showed that it may even reduce cancer recurrence, although I'm still perplexed by that particular study, but I think it's fair and only ethical to present all the data, not just one side. Now, what about diet, in terms of just our body weight? And we do see that those who consume more artificial sweeteners gain more weight, which you wouldn't expect, than those that are consuming sweeteners that are actually caloric. One of the thoughts is kind of how it triggers our systems in terms of our hunger mechanism. And so we may feel that, oh, I didn't take in any calories, so I should just keep consuming and continue to consume. We may be kind of given a cue if we actually had calories in there. So from a body weight perspective, I don't necessarily think that the diet options, meaning artificial sweeteners of Splenda and sucralose or aspartame, are going to be the healthiest option. Cravings, again, we do see that artificial sweeteners do indeed perpetuate that desire for having more and more sweets. And as I mentioned, artificial sweeteners may lead to disruption in our body's rhythm in terms of, are we really satisfied or not? And I think that's something we want to keep in mind. This last bullet point here, this is data from the Women's Health Initiative, that women who had 2 or more artificially sweetened beverages, so they were 12 ounces daily, 12 ounces each, so a total of 24 ounces, just to be clear, had a 23% increased risk of stroke and a 29% increased risk of heart attack. So I don't think that artificial sweeteners are without any negative consequences. A couple more areas here, looking at the area in terms of type 2 diabetes, because of course, originally, artificial sweeteners were designed to be a substitute, for these different, foods that would, provide sugar and affect our insulin levels. But we actually see studies that suggest that artificial sweeteners may actually alter the way our bodies manufacture and work with glucose. And if we have them more frequently, or if we consume them for a longer period of time, that actually could be associated with a positive increased risk of type 2 diabetes. So there are a lot of concerns that I have with these different areas. I would note too that Splenda is a chlorinated compound. It is 600 times sweeter than sugar. And when we heat a chlorinated compound, it basically will form dioxin-like compounds. So if you were to ever use Splenda, please do not heat it. Don't have it in a canned food. Don't have it in a baked good, because it actually could then be very concerning with having those dioxin-like compounds. And then the last area that I have on artificial sweeteners is the area of digestive function. I think this is an area that is really, really intriguing, that we're actually seeing data now suggest that these artificial sweeteners like Splenda may actually negatively affect our gut microbiome in a way that promotes dysbiosis. It promotes more of the bad bacteria and less of the good bacteria. And as you all know, because you're on this call, you're likely bright and following these different things, our microbiome is going to be foundation for all different health related issues. And so I do think we want to be very cognizant of anything that has a negative effect on our microbiome. Now, if you had Splenda once a year, I'm not so worried there, but this is more of a regular consumption pattern that we would want to be, cautious with. So I want to then also touch base, and actually, I think there were also a couple questions. What about stevia? And I would say that stevia, also monk fruit, I think those could be added. Those do not have calories. They also are not considered to be in the artificial sweetener category. They are non-nutritive sweeteners, but I do think that those could be utilized. I do think that sometimes monk fruit is one that I sometimes see linked in products that has erythritol. It's a sugar alcohol. That's not my favorite, but just in terms of pure stevia, pure monk fruit, I think those could be utilized and that would be okay. Similarly, also with stevia, there are products out there that are not 100% stevia. If you're going to use those, then definitely I would say we want to use those when they're being at 100%, so that they're not having half stevia and half Splenda, or half stevia and half a sugar alcohol, in those scenarios. So I want to transition a little bit in terms of inflammation, because inflammation is also an area that we know is a metabolic terrain directly linked with cancer. And this is a study, a quote from many years back, but I think it was just so nicely worded. The tumor microenvironment, largely orchestrated by inflammatory cells, is an indispensable participant in the neoplastic process, fostering proliferation, survival, and migration. So again, we know that we want to be assessing inflammation and ideally monitoring inflammatory levels in a way to see, can we keep inflammation most at bay? These two markers here, high sensitivity or ultra-sensitive C-reactive protein, is a very common marker that I think is wise to assess probably for all of you. It's good not that you have to do it every month, but if it looks great under 1, maybe even do it every 6 months or every year. If it's elevated and we make a change, then maybe you would want to look at that again in 3 to 6 months. Fibrinogen is another marker that I like to use for assessing inflammatory status. And then I didn't even put on here, but homocysteine is a marker of vascular inflammation that I think also is a wise marker to assess how is my inflammation overall. I think that can be an important marker. Again, these are mainstream. These should be able to be done through your insurance. And why do we want to look at that is because in having higher levels of inflammatory biomarkers is generally associated with poor prognosis. And so just from a time perspective, I'll kind of go through some of these briefly, but you can see C-reactive protein, not only for prognosis, but those who have higher levels, significantly greater fatigue, I would say that fatigue is generally the top complaint that so many, cancer patients are really suffering with. So if it's going to really significantly affect quality of life, we want to be paying attention to all of these, different pieces. So not only for survival, but also just for day-to-day, quality of life. Here are a couple of studies looking at fibrinogen and prognosis. And again, just seeing an association, looking for those who have higher levels, having shorter disease-free, survival, overall survival. So I think it's a good value just to see where is that level. And if it's in a great range, fantastic, between 260 and 310. If it's not, can we get it there? How do we manage and modulate our inflammatory biomarkers? Again, you can see that it's multifaceted. There are many different nutrients that affect our inflammation. So my answer is not just to give you all of these, but if we knew you were particularly low in one of these areas, well, then definitely that would be a starting point that I would want to assess. But even beyond all of these different micronutrients and different nutritive compounds, we do have our basic anti-inflammatory food pyramid. This I don't necessarily think is 100% perfect, but I think Andrew Weil did a great job in terms of giving a sense of where we're trying to do. I think we want that base to be, vegetables and fruits. The pasta that he put on here, I think honestly, one area that we want to just kind of note is I don't think you have to have pasta 2 to 3 times a week, but if you were to eat pasta, know that cooking it al dente has a lesser effect on glycemic role, in terms of lesser effect on how it affects your blood sugars. We want to have those healthy fats, the omega-3 fatty acids. We want to make sure we're getting in protein. I haven't yet mentioned herbs and spices. Those are your richest antioxidant sources. So turmeric, ginger, garlic, cinnamon, rosemary, use them prolifically, right? So those would be fantastic. Green tea and variations of that. Cancer-wise, red wine, there can be pros and cons. Depending on the cancer, we do see estrogen. Typically, if we have more alcohol, higher estrogen. So something to keep in mind if you have an estrogen-related sarcoma that's being affected by that. And then dark chocolate up there. Again, yes, it does have antioxidants. Andy Weil does love dark chocolate. He is certainly an aficionado of really, really high-quality, good chocolate. And I think the key there is if you can get all those other things and you have a little bit of dark chocolate, I don't have a problem with that. But do choose dark, do choose high cacao above 70%, even 85%. And then just be wise in terms of the amount that you would be consuming. I do want to share here, this is the balance of our essential fatty acids, omega-6, omega-3 fatty acids. These are both essential categories in terms of that we can't make them in our own system to enough. So we do have to pull them in from our diet. And the balance between them is what's so crucial. And we tend to, as American diets, have excessive amounts of omega-6 and we lack omega-3. So we want to try to have a better balance that helps us to really be able to reverse our disease processes. Theoretically, if we could have a 1-to-1 ratio up to a 4-to-1 ratio of omega-6 to omega-3s, meaning you could have up to 4 times the amount of omega-6 fatty acids as you do omega-3 fatty acids, just as a kind of thing. And we'll talk about a few of these different sources here. So omega-6 fatty acids, while they are essential, when in excess, we do see that they actually have an inflammatory effect. They can foster the growth of tumors, progression, angiogenesis, or the formation of blood vessels, and suppress immune function, where the opposite occurs with the protective omega-3 fatty acids. So you can see there different dietary sources, in terms of the omega-6 and omega-3 fatty acids. You really want to focus more on the cold water fish, the chia seeds, the flax seeds, the walnuts, a little bit of hemp seeds, pumpkin seeds. Those are good sources of your dietary omega-3 fatty acids. Time-wise, Sharon, I know I have nutrigenomics, intermittent fasting. Should I go ahead and do both of those, or do you want me to cut one of those out? Or are we doing okay?
No, we'll take you as long as we can get you.
Okay, so I'll do this. I debated about if I should pull this out in terms of time, and then I was like, how do I delete it? Do I add it? What do I want to do? Because there are so many topics I know that we could discuss. So,
Right.
but I do think that this is a really important area. And while we may be somewhat at our infancy or early childhood in the area of nutrigenomics, of the area of how our nutrition, modulates the way our genes are expressed in lowering or increasing one's risk of different types of conditions and diseases, this is definitely here. This is something that I find helps us to better personalize suggestions. So I mentioned a few of those biomarkers related to blood sugar, related to inflammation. This is another area that we can use to really personalize dietary supplemental suggestions, is looking at your genomic profiles. And many of you may have had different kinds of genetic testing, chemo testing specifically on your tumor tissue. This is a little bit more broad, not necessarily meaning it's a specific only cancer, but I just mentioning here 3 different what we call SNPs. SNPs are little pieces of your DNA, little material, just a little section of it. Technically, it's a single nucleotide polymorphism, but you probably don't want to know that term. So SNPs are little pieces of your DNA material. And the 3 here are MTHFR. You may know that as another term, cont, and FADS that I'm mentioning today. There are many of these, but these are just 3 that we can kind of squeeze into today's conversation. So MTHFR is probably and arguably the most commonly assessed SNP here, and it is definitely one that has a lot of science behind it and will continue to grow. This is related to our body's ability to how our system methylates. And methylation is a chemical process that is adding a methyl group, carbons and hydrogens. You don't really need to necessarily know the details of the chemistry, but methylation is virtually going to affect every cellular process that occurs. So if one is not methylating enough or methylating too much, it can influence cancer, it can influence stroke, it can influence our ability, our aging, it can influence our thought processes, it can influence it's going to influence virtually everything, okay? And MTHFR in particular is related to our ability to activate folate, one of the B vitamins, to the version of 5-MTHF or methyl tetrahydrofolate. But again, methylated folate is kind of an easier term, there. So if we knew, I have an MTHFR genomic variation, and there are some different ones. That's generic to say that, but just in general, how we have some, then you'd be like, okay, well then if I ever take B vitamins, I know I must take them in a methylated version. If I go to Walgreens and get a synthetic multivitamin with synthetic B vitamins, probably not going to help me at all, and actually may make things worse. You would want to make sure that they have methylated B vitamins. And so if it was folate, it will say methylfolate, or you may see 5-MTHF when you're looking at the label. For vitamin B12, it will say methylcobalamin. Could also be adenylyl hydroxy, that's a tricky one. But in general, it's not going to say cyanocobalamin, like cyanide. That's a synthetic version. That's the common one you see in your standard, B vitamins and multis and so forth. You don't want cyanocobalamin. You want it to be methylcobalamin or adenosylcobalamin, but generally methyl is probably more common. For vitamin B6, B as in boy again, P5P, pyridoxal 5-phosphate, would be considered the most bioavailable form of vitamin B6. So if we know that there's some sort of challenge, and these are also strongly linked to focus and attention. We look at these in terms of ADD. We look at these in terms of anxiety. We look at these for a lot of different factors. But that helps us, again, to better personalize our scenario. COMT, catechol methyltransferase, bottom line here, it is basically how well do you metabolize estrogen and how well do you metabolize stress hormones. So if you metabolize these well, fantastic. If you don't, you may find that estrogen, higher estrogen dominant related issues become a problem. Whether that's cancer, estrogen related, or whether that's, fibrocystic breast disease or other types of, just not so much, as significant as cancer, but still having a definitely significant effect, polycystic ovarian syndrome and so forth. And then in terms of your stress hormones, if we don't metabolize those well, you can imagine, you may even find that you're depleted or you're beyond anxious because your system's not allowing you to clear those out of the system. So this I find oftentimes can be also very beneficial. And there's even studies looking at those who had COMT. There was a breast cancer trial using the mindfulness-based stress reduction course, had a significant impact, beneficial impact for women who had the COMT variation to take that particular class. Very interesting. And again, it's not going to hurt anyone to take it, but I think particularly somebody who may be more prone to having those challenges, then we can kind of highlight those areas. So here, if I was looking at overall, COMT, I would be thinking, what about magnesium? I like magnesium glycinate. It's the most bioavailable form of magnesium. There could be, if I really wanted to focus on anxiety, magnesium threonate is the best in terms of anxiety. If we thought we had too much estrogen, or not thought, if we had tested and we knew estrogen was a little too high, there's a compound called DIM. It's a metabolite of cruciferous vegetables that helps to lower estrogen and has a very favorable effect on estrogen metabolism. This certain type of B12, adenosyl hydroxy B12, is particularly beneficial if somebody has a variation with COMT, and possibly even using SAMe, which is oftentimes used for depression and mood-related, challenges. Again, not that we're going to always use those just because somebody has a variation there. Those would just be some things that I would be thinking of and determining would they be useful or would they not be. The last one here that I mentioned is FADS. It's fatty acid desaturase. This is how well do you convert the plant version of omega-3 fatty acids, the type you'd find in flaxseed, the type you'd find in chia seeds, walnuts, hemp seeds, and so forth, to the active form of EPA and DHA. So if you can convert that readily, fantastic. It's not known to be the most efficient process. And definitely, if we know you have a challenge of converting that and you're vegan, we've got a problem. How are we going to get you to have EPA and DHA if you can't convert it? So that brings up more discussion in terms of how do we get that in the system. And these types, there are a lot of different labs, of course, that run these. There are ways, even with those of you who have done things like 23andMe or Ancestry.com, I don't really use that data, but I do use the raw data from those tests, and I upload that to a different platform to identify about, it keeps growing. I should probably count it right now, but I think it's probably more than 50 different SNPs. I'm listing 3 here. So there's a lot of really interesting information that we can get at, and not that it's going to say, you have to do this or you can't do this, but it helps to guide us. It helps to personalize your path. So it's not a generic path overall. And then I also just want to mention the area of intermittent fasting, because this is definitely an area that's growing. So first, what is intermittent fasting? Intermittent fasting is basically you are fasting and not eating, definitely drinking water, but basically water fasting for a set number of hours every day. And then when you're not fasting, you kind of eat freely in those remaining hours. The thought for intermittent fasting is probably between 13 hours of fasting up to 18 hours of fasting on a daily basis. I think 13 is a good number to kind of set yourself, depending on kind of what you're doing currently. 18, I think is not only very, very challenging, but I worry, can you get all of the nutrients you need in 6 hours? That's not very much time to eat. So typically I'd say 13, 14, even 16 hours, I think is typically going to be plenty, and is something that could be, interesting to consider. There are some metabolic improvements that we are seeing in terms of body weight, in terms of insulin sensitivity, in terms of glucose regulation and blood glucose values, inflammatory biomarkers. Those I think are definitely promising, not conclusive, but promising that it could be something to keep in mind, for anyone, but definitely think, within the realm of oncology. Now, with cancer, in terms of intermittent fasting, there does seem to be possibly an anti-cancer effect by enhancing the oxidative stress components when we are, in a fasting state. With that well study that I mentioned, they did find that women who fasted for 13 hours or more did have a reduced risk in terms of recurrence. So I think that's an interesting, data point. And so the other part that I would say really in terms of fasting with chemo, because we definitely need more research in all of these different areas, is there could be the thought of what about fasting the day prior to chemotherapy, the day of chemotherapy, the day after chemotherapy, and the thought being, does it allow the chemo to work that much more effectively? From an anecdotal perspective, just in terms of what I've noticed with patients who have been able to do that, years ago, my fear was, how are you going to do with nausea? Is nausea going to be an issue? Are there going to be more challenges? I've actually found less side effects, from chemo for those that are able to do, fasting around those days. Now, that can vary. I do have a few who do water fasting for those 3 days. I've also had patients where that's a little bit too much. And so I have a few patients who do just broth and bone broth those 3 days, but they're still having a little bit of nourishment in there. I've also had I had a young breast cancer patient who was trying to fast, and I was like, Kim, like, you're exhausted. She has 2 little young children. She was kind of like, wandering around like, you don't have enough nourishment to really kind of get you through. In her case, what we did is we just said, okay, we're going to pull all carbohydrates. No carbs day before, day of, day after, but we're going to allow protein, we're going to allow fat to make sure that you're nourished, to make sure that you're able to be strong enough to parent your children, to enjoy your life. It was starting to kind of have too many negatives than positives. I don't think, again, that there has to be one right answer. It's what's the right answer for you. And that's going to vary in terms of your strength, in terms of where you are in treatment, in terms of what you've already been through. All of those factors are going to affect what decision that you may make and when you make that. But this is an area that I would just say, keep it in mind, keep watching the research here. It does look to be intriguing. It is not conclusive, but like I said, it is something that I certainly want to continue and watch. This is just kind of showing you a couple of the particular chemotherapy regimens that have been shown to be improved, like etoposide, the mitoxantrone, oxaliplatin, cisplatin, Cytoxan or cyclophosphamide, doxorubicin, seeing some of those. Now, those studies were animal studies. Those were not in human studies. Again, we definitely need more human data, at this point. Again, these are also animal studies looking at the radiosensitivity of breast tumors in mice with alternate day fasting. I have not really done that yet in human studies or in human patients. There's some animal data suggesting that there were non-statistically significant trends, but still showing benefit toward improved cancer survival with some of the intermittent fasting regimen. So again, we want to watch it. Let's just keep our eye on it, possibly to consider. So in summary of kind of our discussion, we still have Q&A, I know. 1, is a healthy diet really going to help? Well, clearly I'm biased. But beyond my bias of being, board certified on oncology nutrition, is that I definitely think that it will reduce risk of chronic diseases, undoubtedly. It's going to reduce inflammation. It's going to improve your glycemic control. We hope that it helps to prevent cancer or inhibit the growth of cancer cells and or lower your risk of cancer recurrence. We know that it will help to strengthen your immune system, to improve your energy levels, to facilitate your recovery from treatment so you have lesser toxicities of treatment. We know that we can use diet to favorably affect your genetic expression, and it empowers you. You have control of these decisions. So I put kind of everything in one slide. What are we looking to try to achieve? Again, this could vary depending on the scenario, but 8 to 10 colorful vegetable fruits and servings a day, meaning 5 or more vegetables, 2-3 fruits, not 9 fruits and 1 vegetable. If you get all those in, you have a little chia seeds, a little bit of, legume, a little bit of this, you're going to meet your fiber goal, no problem. Limiting those processed, refined grains, flours, and sugars, being mindful of the fatty processed meats and the dairy, yet allowing and encouraging you to have some source of protein with all of your meals, plant protein too, but if you are incorporating some lean animal protein, I'm okay with that. Preferably high quality. We're not getting into the issue in terms of organic, but if we could, I do like the idea, if we're going for meats, to be choosing organic, particularly meat and dairy being higher on the food chain. Those are even more important to purchase organic, even more so than produce if we had to choose. Including healthy fats, the cold water fish like we talked about because they're so rich in the omega-3s, the flax seeds, the chia seeds, walnuts, olive oil, avocados, almonds, other kinds of nuts and seeds are great. Liberally using herbs and spices, possibly looking at the use of flax and chia, not only for the omega-3s, but even for bowel regularity or for satiation could be valuable. Green tea to get in extra polyphenols and antioxidants. Making sure your vitamin D level is at least above 40. I really like 60. But if your practitioner tells you, oh yeah, you're at 36, you're above normal, but no, get a little bit higher. We really want you to be closer to that 60 mark. Keep in mind of limiting alcohol or avoiding alcohol together and doing some sort of physical activity to help achieve and maintain a healthy body weight. So that's kind of a lot to put in kind of one slide. Naturally, we could vary this per individual, but just to kind of give you a ballpark idea of kind of what we're looking to achieve. That is a one slide piece. And remember that what we eat really is at the heart of our daily existence. So we know, and you've heard, food is your medicine, that not meaning necessarily that you're going to do only food and not do any kind of medicine or Western treatment, but more so that you can use it as an adjunctive therapy to truly help mitigate, side effects, enhance your therapy, have you feel, hopefully lessen the cancer burden, and most importantly, perhaps, is improve your quality of life and your sense of well-being, among those areas. So all things to keep in mind. Before I open up to Q&A, I just wanted to, put out there, if you are interested and you want to have I do have like a, twice a month I've been doing a newsletter since June. And so if you want to get on the newsletter list, you can go to my website, natalieledesma.com, and happy to do that. I put a couple some of the older newsletters that I put up there in the form of a blog, so you're welcome to read through those. If you are interested in microbiome, I currently have a webinar that I did on the microbiome that is available at no cost. That's available there as well. If you really want the heart and soul of that class, I can get you that, also. I'm happy to do that. And obviously, I'm located here in the Bay Area. And happy to work with any of you that may live anywhere, because these days we're doing everything virtually, right? So I don't want to possibly infect anyone else's family. So a lot of Zoom, FaceTime, phones, things like that. And we could easily work, individually if there are particular things, and kind of get, what labs you've already done and be able to help better personalize, your situation, your case. So I'm going to, and Sharon, you can stop me or do anything, but I was just going to kind of go through the Q&A or the chat.
Just a wealth of information. I'm so glad we recorded this, because I'm going to have to listen to it several times. But anyhow, if people want to unmute themselves, they can ask questions. We also have some we'll start with in the chat box. Can you read those?
Yeah, I'll look at the chat. I see
I can read them.
The leafy green scenario, with COVID. With the fresh greens, in terms of safely cleaning them, typically, honestly, I tend to do predominantly just water, but you could do vinegar. Vinegar is not going to kill COVID. I think in general, we haven't been too concerned of COVID being on foods. It seems like that has not been as much of an issue. So, but I think as long as you're washing them, you could also use a fruit and vegetable rinse if you want to have out more of the dirts and things. But again, not something that typically is going to be killing, COVID. From a COVID perspective, I do like to, again, make sure that vitamin D levels are up there, because there definitely is evidence to suggest, and not enough conclusive evidence, but nonetheless some evidence to suggest that those that have higher levels of vitamin D seem to be less likely to contract COVID. Those that have been, in the ICU and having more severe cases of COVID tend to have lower levels of vitamin D. So definitely reason to make sure your vitamin D levels, are substantial and that those are robust. I think zinc is also important, because zinc you're going to use to generate white blood cells, and particularly if you're in active treatment, oftentimes the treatment is, affecting and suppressing our white blood cells. So our need for zinc goes up. But if you're doing chemo, your desire for oysters and protein foods that are high in zinc is probably less. So that's something we can also kind of watch if you think that that's an area. Question in terms of antioxidants and interfering with chemo. Years and years ago, I went, I think it was 2002, to a conference at the National Health Institute in Bethesda, Maryland. And it was 3 days of we don't know, we don't know, we don't know. It was the most frustrating conference I've ever attended in my life. But ultimately, and again, even being almost 20 years later, essentially food-wise, you have a green light. So you can eat all the colorful, rich foods that are going to be high in antioxidants. That we're not concerned about. When you talk about antioxidant supplements, coenzyme Q10, vitamin C, alpha folic acid, and so forth, then typically what we'd want to do is, depending on the type of treatment, we may use them, we may hold them, or we may kind of pulse them in and out. So oftentimes with chemotherapy, I will hold even mushrooms, CoQ10, even omega-3 fatty acids for the 3 days around chemo. So day of chemo, couple days, 2-3 days afterwards, hold it, and then be able to resume, thereafter that. Otherwise, because sometimes using omega-3 fatty acids like fish oil may actually even enhance the effects of certain chemos. So I do like to use them, but again, we kind of look at which chemo. That's obviously more challenging if you're doing an oral chemo that's kind of on a daily basis. Immunotherapies, we have lesser research on, so that gives us a little more of a challenge in terms of knowing what's going to interact and what's not going to interact. We don't really have enough data, there at this point. But dietarily, I'm not worried about you limiting antioxidants. You could have green tea. I wouldn't drink 10 cups of green tea. You have 1-2 cups of green tea a day, even during chemo, not an issue. 10 cups a day could possibly interfere. The thought is, would those antioxidants prevent the chemotherapy or the radiation from having their oxidative effect? Obviously, we want it to have an oxidative effect on the cancer cells, but we really want to be protecting, the healthy cells. So there, again, more research undoubtedly that we need in that area. I think we talked about the plant-based, testing for inflammatory markers, nutrigenomic SNPs, generally covered by insurance. I find that the inflammatory markers, A1C, C-reactive protein, fibrinogen, I generally don't have a problem. Homocysteine, I don't have a problem getting those covered by most insurance companies. The nutrigenomic SNPs, typically that's not done through your mainstream. You're probably using an outside lab, so that could be separate. Cheapest is going to be the $99, 23andMe, Ancestry.com. I have a lot of patients who use that because they've already done it, or because of the cost. They get a coupon, it's even less. I have some patients who choose not to, just from a privacy factor, and then those patients will use, I sometimes use Smart DNA. That's a good company. They're based actually in Australia, but then the costs generally go up. That one's like $420, and I don't think at this point any insurance is covering that part. And typically, even like that SpectraCell micronutrient test, although they're changing things at the end of the month, and I'm very disappointed, oftentimes insurance will cover portions of things, so that somebody is, like a $1,600 test, maybe they pay $190 for it, but they're not paying $1,600. Medicare for micronutrient test, actually you have a better deal. It's only $88, but I pay $190, for that one. So some tests do have out-of-pocket costs. Sometimes it goes towards deductible, sometimes it doesn't. Depends on insurance and so forth, too. Let's see, what else am I seeing here in terms of the question? We all seem to suffer from intestinal problems. Any ideas about being proactive self-care apart from eating small meals? So there honestly depends on kind of intestinal problems is a big area. So is this like inflammatory bowels? Are we talking just a typical constipation, a typical diarrhea? Are we talking acid reflux? Are we talking bloating? All of those would possibly, look at different scenarios. In general, if we don't have an issue in terms of constipation, I'd say, are you getting enough fluid? Are you active? Are we getting in enough dietary fiber? I think magnesium is an area that it gets depleted with stress. So magnesium we tend to be low in. If we're looking for magnesium for a laxative-like effect, magnesium citrate is the best for that purpose. And I definitely use magnesium citrate regularly for patients who are struggling with constipation. Sometimes it's not even so much the chemo or the cancer, it's more so the antiemetics, the nausea meds, or some other kind of med that can cause, that, type of effect. If it's diarrhea, then I may look, making sure we're not having too much in the way of raw, items, even leafy lettuces sometimes don't have much fiber, but they can tend to wreak havoc on one's bowel. I'll make sure that we're not using flaxseed and too much in the way of coffee and things that may be exacerbating loose stools. I do think that chia seeds are something that you can oftentimes use because, flax seeds are great if you're constipated. If you have diarrhea, flax seeds are going to make things worse. But chia seeds, you could be constipated or you could have diarrhea, and they should kind of push you to that middle ground. So chia seeds, probiotics are two things that I think you could, or in both scenarios, you could use chia seeds and probiotics. Again, it could be a couple considerations for probiotics, but that's something that you could kind of play with. If you were using chia seeds, you had diarrhea, I'd probably start with like a teaspoon. If you had constipation, you're starting with chia seeds, I'd say start with a tablespoon. You could go up to using even a quarter cup of those on a daily basis. There definitely are other herbs and botanicals and things like that. If we think it's motility, ginger's a very good prokinetic, kind of pushing things in peristaltic function downwards. Melatonin has that same kind of effect. If we think it's bloating because you don't have enough stomach acid, you can even do a simple test that I call the baking soda test. I talk about that on that webinar that's free on my website. So it's something you could easily do at home. It doesn't cost you any money. And so if you thought, my problem is that I get bloated after I eat, or I'm not bloated at the beginning of the day, but by the end of the day, I feel like I'm really uncomfortable and bloated, that tells me you're not breaking down that food appropriately. And every time you add food, you're getting more and more, distended. So that makes me question, do you have adequate stomach acid to break down that food appropriately? And we want to have adequate stomach acid because otherwise we can have bacteria and things growing, as well. So we don't want to have that in there. Since starting chemo, I can't stand the taste of water. That is not, unfortunately, you're not alone. So one of the things sometimes I find is there's a slight flavor that does tend to work. You're mentioning the Crystal Light lemonade. Only challenging there is you're going to get some of the artificial sweeteners. I've had some people just use water. They put lime in it. They put strawberries in it. They put, orange in it or something to kind of help just do it. There's the brand called Hint water. And I have had a few patients. I had one patient in particular who just couldn't get any water in, but she would drink the Hint water bottles, no problem. She would be able to do, herbal teas, no problem, but that just flat water would have a really kind of odd, taste to it. If it's a metallic taste, red flag, that one makes me think, is your zinc level low? So have zinc level tested or add a little zinc and see if that would be beneficial. If you add zinc, do zinc glycinate, because a lot of the other zincs are going to upset your stomach. So that's, if it's just kind of a blah taste, which is even more common, then it may be kind of, how can we possibly, modify that? Because it's true, unfortunately not alone. Some people do broths because that will have more of a savory flavor. But I think kind of adding a little bit of something to water, Sometimes the sparkling piece is nice. Sometimes people, the sparkling thing makes it worse in terms of that carbonation. And that can definitely, certainly affect our challenge. One thing just in general, in terms of taste, if you find that food just isn't tasting right, and again, in metallic, red flag in terms of the zinc level, but if it's just cardboard, blah, not having enough taste, one thing that I always think about is FASS. It's an acronym for FASS: fat, acid, salt, sweet. And oftentimes, if you think about what you're eating or drinking, a little less in terms of drinking, but if you're looking at your bowl of soup or your plate of food, and you kind of look and say, it doesn't taste right. Is there a little bit of fat in there, a little bit of olive oil, a little coconut, a little avocado, a little bit of nuts, something to give it a little bit of fat to help kind of mute, I think, sometimes the bitterness, and also kind of help with the palate and the creaminess and the texture. What about acid? Sometimes broccoli or something like that may be like, oh, it doesn't taste right. Squeeze some lemon on it, and it's like, oh, boom, it just kind of enhances the flavor of that food so much. So think about lemon, lime, vinegars, just a tiny bit to kind of really enhance the flavor of a food. Is there a dash of salt? Potentially, doesn't have to even be salt. It could be you're using seaweed flakes or something else that provides that saltiness, but that little bit, that kind of a umami kind of a flavor. And then possibly even something a dash sweet. You know, I'm not a huge fan of sweet in general. However, sometimes you may find that, in your, cup of soup, if, the 16th of a teaspoon of maple syrup just really has the flavor, be amazing, and you eat the whole bowl, well, then that's definitely going to be well worth it. And so if food doesn't taste good, a lot less likely that you're really going to be, consuming that. So that's, I think, important to keep in mind. Another question here in terms of how do you regain muscle mass, that's lost to treatment. In a perfect world, I like to identify what's metabolism like. So I tend to run a test and measure metabolism. It's a breathing test, the indirect kilometer. You put a little nose clip on your nose, you have a little handheld device, takes about 10 minutes. That tells me just how many calories are you burning at rest. Of course, I like to make sure that thyroid's not an issue. I like to kind of look that cortisol is not a component that's playing a role. But then I want to look at inflammation, because if we have a lot of inflammation and you're in more of a cachectic scenario that you're eating, but you find that no matter what you're eating, you just simply aren't gaining weight or aren't gaining muscle mass, then it could be that we have too much inflammation, too many pro-inflammatory cytokines that are not allowing your body, despite eating 3,000 calories, to gain any weight. We control the inflammation, bring the inflammatory markers down, then you're eating, then you should hopefully gain weight more easily. Of course, we're looking at protein. Of course, you want to look at omega-3 fatty acids. There is some data to suggest that having omega-3 fatty acids can help to maintain muscle mass and possibly build that up. That's typically, researchers use 2 grams of EPA. It's one type of omega-3 fatty acid specifically. Yes, we need more research, but certainly worth trying. There's also a product called Juven, Juven. I don't have any association with them or any of those companies for that matter, but that product also is a combination of glutamine, arginine, and HMB. It's been shown to help to improve body cell mass. It's a powder that you mix with water, and you have a liquid, kind of this little a drink twice a day. And that's also, been another option sometimes I'll look at. So I kind of come at it from different angles to determine why, and are there any things that we know we can definitely tackle to be able to, grab from there. I think, Sharon, I got through.
I think you got through most of them. Anybody else have questions? You can just unmute yourself.
Yes, I have 1 or 2. Natalie, this has been so helpful. Thank you very much.
You're welcome.
Can you speak, there's a lot of anxiety that comes with this diagnosis and fear. Like for the first year, I was terrified to have sugar. Can you just speak to the balance of, if you love an ice cream cone, what do you think is a good rule of thumb, or a glass of wine, indulging once a week? And then I also had a question about hormones and meats, particularly, if you're getting takeout. I've been reading up about, even chicken, if you eat chicken from a restaurant, could that have hormones in it or other meats?
Right. Okay. So first, I think in terms of balance, and I think, part of whether it's the, kind of the brilliance of it or the challenge of it is that where one feels balance is going to be different for probably each and every one of us. Right. And so if, you finding like, okay, what would be reasonable in terms of still allowing? Because like I said, I do find that if you say, no, I just can never have these things. And it's one thing to not have something for a month, for a few months, but for, 30 years, it may be like, well, wait, what's the pros and cons? And is that definitely, a supported component, evidence to really have to do that? So in general, I would say, when you're thinking about something that you feel like, well, it's probably not the healthiest thing for me to be eating or drinking, but I would really like to be able to have that. Again, focus on, did you get and meet your different goals that day? Did you have vegetables with at least 2 of your meals? Did you have protein at all of your meals? Are you adequately hydrated? Have you had some sort of physical activity? Have you, do you have enough healthy fats, in there? Have you, had 5 minutes of some mindfulness time or whatever on your list, or your concerns? I think that's something to kind of be like, okay, hit my nourishing criteria. Now I possibly can do this. And I think, once a week, I'm not so worried about you having an ice cream cone, probably once a week, or having a glass of wine once a week. I think the challenge is, well, I only have these once a week. And then it's, well, I have ice cream on Monday, and I have, then I only have ice cream once a week. I only have wine once a week. I only have Skittles once a week. I only have Snickers bar once a week. I only have cookies once a week. And then all of a sudden, if you like keep going, you're like, and every day I have something, then we've got a new challenge. But if you really are feeling like, you're allowing something like that. And again, I'd say in the case of an ice cream cone, have one, don't have it be, the 500 scoop, ice cream cone, or, the glass of wine that you can fit the whole bottle of wine in the one glass, but just be reasonable, I think, in terms of that, of your portion. From ice cream, there are a lot of healthful, options out there. I know I've used, sometimes I'll make, and I don't know if it's somebody gifted us a ice cream maker years ago. And then I could see in terms of the, I'm just going to stop this per request here. I could make one that was just coconut milk, vanilla, and possibly a little bit of some sort of maple syrup or a little bit of something like that. And then really not getting very much sugar and no additives and things like that. I've also made one of the websites I've seen that has some amazing kind of non-dairy ones with banana. One of them was like a banana peanut butter one that was divine. I haven't made that in a while. But I know, in fact, my 14-year-old was like, hey, we should make that again. So we should get the ingredients up. But there are a lot of, I think, helpful options that you could look at. And even if you were like, I'm not going to make anything, I don't have the energy to do that, and you're at the store, you'll look at 5 different brands, and you're going to see for a half of a cup, the sugar content could range from 12 grams to 36 grams of sugar. Mm-hmm. So be wise, even in terms of your options, which one makes the most sense, there. In terms of, wine, I think, again, a lot of it depends also on how's your blood sugar, how's your, glucose management in that sense, because that can definitely give us more information too. But I think, just kind of being mindful of those, factors. Typically, when alcohol is, 2 or less on a weekly basis, I'm generally not going to bark too much at any of you. If you're having, a bottle a night or a bottle every other night, then we may say, well, that may not be the healthiest, scenario, for you. The question in terms of hormones, I agree. I mean, I think one of the challenges that things that are highest on the food chain, like meat and dairy, typically do have, a higher amount of, hormones and things like that. If you're having food out at a restaurant, which in general is probably going to not be organic, because there could be a few exceptions, and there are some that have access to organic meats within restaurants. But in general, probably most restaurants, across the country, obviously don't necessarily have organic options on, all the way there. If you're doing that, every other week, once a month, I'm not worried about that. If you're having, takeout from a restaurant 4 times a week, then I think it does become, more of a
Mhm.
consideration of
Yeah.
what those, things are, what, how the meat is there, what oils are they cooking at it in, and so forth, all of those different pieces. But I think, again, if it's just something that you're doing, less, once a week or less, then if you have options for organic, then absolutely. Obviously, I encourage, to be able to have healthy homemade foods. But I also know that fatigue, exhaustion, preparing, it just sometimes is really, really challenging. And sometimes I think too that you're, even if you have somebody who's helping you, but, they need a break too. And so certainly, being able to have options, and I'm sure your friends and your family and your communities are helping, hopefully, with some foods. And that can definitely be a beautiful way to help eat healthy foods. And I think sometimes in those scenarios, for some of those like meal trains and so forth, looking through some cookbooks and having, some ideas, I think oftentimes being on the other side, people want to know what can they specifically make. So you don't get 20 chicken noodle soups and 20, lasagnas, that you get something you particularly want. And you probably are familiar, but Rebecca Katz, Katz, she's a chef here in the Bay Area. She has beautifully illustrated cookbooks. So not only is it, are they fun to kind of look at, but when you're not that interested in food, those pictures speak a million words. And so sometimes I find if you're able to kind of page through a cookbook like that, or even looking at her website to get a few ideas, snap a picture of it and say, oh, if anyone would make me this, give some ideas. People would love to be able to really help make something that you really would like to have. So don't be shy in terms of, even giving a little more guidance for those of you who have people who are willing to prepare and help, with foods and meals too.
Hi, I have a question. Can you hear me okay?
I can, Lauren, yes.
Okay, great. Thank you so much. This is amazing. I wrote the long catabolysis thing, but let me just make it short. Because I'm in treatment, I feel like a lot of the incredible information you gave us today, in a way, is about what happens before treatment or something. And so, I just came out of radiation, but it was also true on chemo. And after I had my tumors resected and stuff, people are always giving me different kinds of advice about how much protein to eat to build my body back up, or whether during healing you have to change your diet. And I'm sure you know more about that than my doctors. I mean, because they don't know anything, but they have they have a sense that somebody will. So I'm asking you about that.
So 2 facts. One, in terms of today's discussion, you could interpret that really in terms of pre, during, after, but in terms of assessing the biomarkers in terms of blood sugar, in terms of inflammation, in terms of intermittent fasting, in terms of nutrigenomics, all of those are 100% relevant, whether you are just looking at prevention, whether you are in the midst of active treatment, or if you're in remission and you're just looking to optimize your diet. So just know those are important no matter where you stand in this process. In terms of when we're in somewhat more possibly of a depleted state, or really kind of fighting to kind of make sure that we don't get, more depleted, protein does tend to kind of increase its, need. Oftentimes what I will do, depending on one's body weight, depending on what protein status is looking like, we'll use typically 1.2 to 1.5 grams of protein per kilogram body weight. So if you're at a healthy or a low body weight, you could take how many kilograms are you, multiply it by 1.2. That's probably going to be a pretty good amount of protein that you want to have on a daily basis. If you're in a little more of a depleted state and you're really fighting, you may want to go up to 1.5 grams of protein per kilogram. This is probably not in your situation, but if somebody is really, really struggling, we need to kind of really top it out, you could go all the way up to 2 grams of protein per kilogram body weight. The exception there would be if we're overweight or obese, then you're not going to take your total body weight. We'd have to use an adjusted body weight, because if somebody's 300 pounds, some of the fat tissue is not going to be metabolically active. So you won't necessarily have to have, that much more, protein. So we do have some adjustments there, but just in general, that does kind of give us a sense. And then, as I was mentioning earlier, from the catabolic perspective, that you can look at the area in terms of omega-3 fatty acids. You can even look at metabolism if you have somebody who can do indirect telemetry, and or you could look at even the possibility of something like Juven and or other nutrients that are very building, in that sense, to help make sure that you are in a strong, either maintaining or kind of working to kind of rebuild as you continue, through treatment that we know is still putting a stress on your system.
Well, thank you very much. We're running out of time. Once again, what are the services you can offer us and how do we contact you?
So depending on where everyone's located, but in general, I can do, like I said, remote access in terms of individual consultations. If we decided we wanted to look at any particular types of labs and do lab work analysis, happy to do that. If you're interested in possible, courses, I probably tend to run a couple courses a year that are webinar-based courses, 4-week type of courses. Just put your name on the newsletter list. I do 2 newsletters a month. You're not going to get more emails probably than that, unless I may have sent a COVID email when that whole, things kind of came out. But in general, I'm not spamming you. I'm not selling your email addresses to anyone. I don't have anyone to sell them to, but I also wouldn't do that. We could definitely do individual, sessions of kind of working to help best personalize your care. I typically do sessions that are based on an hourly basis, and then I also do more comprehensive packages. My comprehensive packages typically incorporate multiple sessions, lab work analysis, personalized supplement plans, depending on the situation, maybe a nutrition-focused physical assessment that we can do even via Zoom if I can see fingernails and tongue and so forth. Sometimes I'm doing, pantry reviews to help provide product suggestions specifically. Again, that can be done also virtually. And then I typically in my packages, I like to incorporate some videos that I've recently developed during COVID times on inflammation. I have one on inflammation. I have one on sugar. I have one on nutrigenomics. I have one on liver detoxification. I have one on stress and HPA dysfunction, and one on gastrointestinal health. I may have missed something. I think I got, those in there. And the thought there with the videos is, one, to provide you with content, both they're Zoom based, so you can see the slides, you can hear my voice, but yet not have to pay for my hourly kind of sessions. But honestly, really even more than that is to really then help our, hopefully certain areas resonate with you. And then you have questions that are really targeted specifically to your scenario that we can then capture, during our sessions. So definitely different options. And if anyone's interested, you can definitely email me through my website at www.natalieledesma.com is the easiest way probably to get in touch.
Well, Natalie, I can't thank you enough. Can we all give her a virtual clap? Yay! So thank you very, very much.